is Jason, senior here at political science, also a Delaware resident my entire life. First of all, thank you for taking time out of your presidential meetings to come first to us here, and you're probably busy.
Nice to get out of Washington.
That being said, the Wall Street Journal just recently ran an editorial which discussed how many of the aspects of Obamacare, this healthcare program, such as making it mandatory for everybody, trying to have a public option, have already been tried in the states, many of the states, and in those same states they have failed most of the time, as the editorial said. What would you say to the author of this editorial?
Well, this won't surprise you, but I don't always agree with the editors of the Wall Street Journal. I'm shocked. And I don't always, I find that what's offered as fact in their editorial is often debatable at best. The fact is that there are features of, there are best practices that we've drawn on in this legislation. I'm sure they pointed to Massachusetts. I saw a poll recently that said people in Massachusetts were overcome. Well, Tennessee is not really analogous to what we're doing, but in Massachusetts, 98% of people are covered now, and the program is actually quite popular. And there are problems with it, and the main problem with it was when Governor Romney passed the bill. When he was governor of the state, he chose not to do the cost cutting that was necessary to make the thing fiscally responsible. And so they've had to catch up on costs, and that's been a problem. But let me say this. I think, and you may disagree, and one thing I think we ought to do in this country is recognize that people can have honest disagreements and still love their country and still believe in the future and so on. So I don't criticize you for having a different view. I'm of the mind, and I think most Americans are, that our healthcare system has real problems, and that if we continue on the path we're on, in the last decade, the premiums have doubled, out-of-pocket expenses have gone up by a third. It's placed untenable pressure on families and businesses, and every projection is that there'll be more of the same, more people uninsured, more people underinsured, more businesses having to drop insurance and so on. We have to deal with this problem, and I guess my answer to those who are so critical is step up and contribute your ideas and help work with us to solve the problem. Don't work to stop a solution to the problem, because that's not in the interest of